ABC News is working with California's First Lady, Maria Shriver, on a special series this week, A Woman's Nation Takes on Alzheimer's. And here at GMA Health, we decided to take a closer look at this debilitating disease and how it affects all of us. We're joined now by neurologist Dr. Samuel Gandy, Associate Director of the Mount Sinai Alzheimer's Research Center right here in New York City. Dr. Gandy, thanks so much for being here today.
Thank you, Tanya.
So the Shriver report focuses primarily on women. Do women fall victim to Alzheimer's more than men?
Well, the incidence is similar, but because women live much longer than men on average, the prevalence is much higher in women. At any given moment, there are more women with Alzheimer's disease than there are men.
And is Alzheimer's on the rise? Is it holding steady? We seem to continually hear more about it. It makes us feel like it's on the rise.
Well, certainly recognition has increased the visibility, but as the baby boom ages and reaches 65 and older, the absolute number of patients with Alzheimer's disease is exploding.
So what is the percentage of people that can expect to get Alzheimer's as they age?
It depends on what age you're sort of looking at. At age 85, half of the people at age 85 or older have Alzheimer's disease.
That's significant.
It's enormously significant, yes.
And do we know whether it's genetic, it's environmental, a combination of factors cause it?
We know that there are some genetic risk factors. We know that is operative in about a third to a half of cases. In terms of environmental factors, the one that's been identified most robustly is head injury.
And what exactly happens to our brains as Alzheimer's sets in?
During Alzheimer's disease, there's a buildup of abnormal clumps of protein, both inside the nerve cells of the brain and between the nerve cells. The clumps between the nerve cells seem to be poisonous, and the nerve cells actually die because of these clumps of protein.
And what is the current treatment? Are there successful treatments right now for Alzheimer's?
There are a few medicines that are approved for temporary symptomatic relief. They don't, however, attack the underlying cause, so the progression continues. They will give some months of sort of restored function, but the decline continues.
All right, and there are some promising things on the horizon in terms of treatment?
There are. Because of research into the genetics of Alzheimer's disease, we have some new medicines aimed at these clumps of protein. And the real challenge now is to get those medicines in before the clumps develop, and certainly before the nerve cells die.
So you're talking late 40s, early 50s is when these people who may be getting Alzheimer's should potentially start taking these drugs.
That's right. We know from neuropathology studies that Alzheimer's disease begins at least a decade before the very first clinical symptom.
And finally, are there groups of people that are more susceptible to getting Alzheimer's? Who's at highest risk?
Well, certainly there's an aging-related risk, and but both men and women are similarly affected. There hasn't been much in terms of sort of a geographic distribution.
Right.
Different cultures seem to develop the disease at a similar rate.
And there's nothing we can do, diet, lifestyle-wise, is there?
Well, certainly all of the things that we know of that are associated with heart health are also associated with Alzheimer's disease. High blood pressure, diabetes, obesity, all those things increase the risk for Alzheimer's, but nothing has been proven to actually slow the progression or prevent the disease.
So Dr. Gandy, how do the symptoms begin to present themselves? How do you know if a loved one may be on the cusp of experiencing Alzheimer's?
Well, Alzheimer's disease is the most common specific disease that causes a syndrome called dementia, which literally means loss of the ability to mentate or to think. Classically, with Alzheimer's disease, the very first thing to change is the loss of short-term memory. That is, people will remember their childhood, but they won't remember, say, what they had for breakfast that day.
And then, of course, the most painful development is when they start to forget their family, correct?
That's right. As the disease progresses, they will begin to forget familiar faces, familiar people. Inevitably, over the period of about a decade, they will take to bed and become entirely unresponsive and die in that state.
Dr. Gandy, thank you so much for all this very important information. And for more of the latest information, please be sure to visit the health page at abcnews.com.